Hello, mates. It's Rav. We are going to be talking about gut health today, and it's a privilege to have Dr. Michael Ruscio on the show. He's written a book. He's a professor. This guy is a doctor of of chiropractic, and he's a doctor of naturopathic medicine. He's written so many journals and publications. It's a privilege to have him on the show. So welcome, Dr. Michael.
Great to be here. Thanks for having me.
Brilliant. And you wrote a brilliant book, Healthy Gut, Healthy You. And just want to really firstly just honor and just respect your work in that. You've really put the science behind this. And we need people like you from a scientific perspective. I do want to start with your own story, because obviously you've been studying and been involved in healthcare and medicine for a long time, and you had your own gut issues. So share your story. I think that'll help sort of the audience and the viewers.
Yeah, no, thank you for asking, and thank you for the compliments, and recognize the importance of just looking into science, because you figure out a lot clinically, but even the smartest clinician is going to have some blind spots or some biases. And that's where sort of crossing over and fact checking your own thoughts can help you become progressively a better clinician. Because really, at the end of the day, it's not about serving a philosophy. I love paleo, I love keto, and let me just try to make the best case for that. But rather, how do we make the best case for how to improve the health of the individual? And that's kind of like where the truth serum lies. So anyway, without going too far afield, yes, I had really kind of like a health crisis in college. I was pre-med, was going to go into conventional medicine. And, when you're that young, you have very little perspective. I saw Grey's Anatomy on TV. I'm like, oh, I want to do that. Right? No real idea of what the other side looks like. So, I was shadowing a few doctors and conventionally, and I was like, yeah, this is nice, but it's not quite what I thought it was. And then my health fell apart, and I went to a few conventional doctors, and they were all well-intended and very nice people, but no one could figure out why I was having fatigue, crippling insomnia, brain fog, low mood. As someone who before was a college athlete and just, I felt about as close to invincible as one could, right? And then I found my way, like many people do, to alternative medicine, because the conventional system, I think well-intended, was trying to help me, but couldn't help me. And I was diagnosed with an intestinal parasite. And that was a huge eye-opener for me. And so I shifted my focus to alternative medicine. And this is what I've now dedicated my life to, in terms of helping people like me who were doing all the things. I was, praying before food, chewing my food thoroughly, meditating, exercising, time outside, sleeping well, eating mostly organic, taking boatloads of supplements, but still my health wasn't great. And that's the population that we serve today. People who are putting in the effort, but just spinning their wheels because they haven't determined what the factor is that's kind of anchoring them from moving forward.
Brilliant. And just tell us the success story, what you did, because I'm sure people want to know how you worked it out.
Yeah, so I ended up having to do a combination of, excuse me, herbal medicines and antibiotics to clear what was an intestinal parasite, actually an amoeba, which isn't very common, but does happen. I think knowing what we know now, because this was about 15 years ago. So we've learned a lot more about probiotics, about herbal medicines. I think I probably, or my case could have been resolved all herbally. Not that I'm against antibiotics, but just to sort of tie in that relevance, that we've learned a lot more as a field about how powerful natural agents can be. As maybe one quick example, fluconazole. People have probably heard of fluconazole, this antifungal medication. It's often used for vaginal candida. There was one study comparing garlic tablets, 500 milligrams 3 times per day, was as effective as fluconazole for clearing vaginal candida. Wow. So we sometimes think that the pharmaceuticals are going to be much more powerful. And again, I have no problem with the pharmaceuticals, but we're seeing exciting little hints being dropped that the natural agents can be as effective, and sometimes with less side effects, than the pharmaceuticals.
Brilliant story. Now, I want to give you 2 archetypes, because we see a lot of corporate executives, we see business leaders, we see entrepreneurs, and let's take it from a female perspective, someone in their sort of 40s, possibly in the sandwich generation, feeling adrenal fatigue, sort of burnt out, insomnia, irritability, little bit of weight gain around the midsection, really struggling just for mental performance. And so we've got a lot of corporate programs that we run in big corporates in South Africa and Africa. Where do you start from a gut health perspective? Because I feel that it's fundamental along people's, journey with regards to looking at their gut. And having done, functional medicine now, I think it's about 18 years here in my practice, I just find this is an area that a lot of people are missing out from a sort of a corporate business executive perspective.
Yeah, I mean, I'll put myself in that category, right? In terms of, I wasn't an executive then, but I am now, and there's a lot that I, have to sort of oversee, and cognition is massively important, obviously, right? You can't problem solve effectively. And if you're in an executive role, it's about, the best decision you can make with limited information and quickly, right? Because it's like, if I think of The Martian, where he's stuck on Mars, and he said, if you can solve enough problems, you get to live. So in this case, it's usually not live or die, but it's thrive or sort of struggle. The gut, gosh, there's a few really important tie-ins. Firstly, in your small intestine specifically, 95% of nutrients are absorbed there. So you might be someone who's eating, like I was, a healthy diet, but not as much of it was getting absorbed as we would like. So if you're someone who's had low iron, low B vitamins, or you just notice that, hey, I'm eating a decent amount of B vitamins in my diet, or at least seemingly so, but I really responded to vitamin B12 or a B complex, that could mean that you're not optimally absorbing. And this is most likely due to suboptimal small intestinal function. So nutrient absorption is one. The other that may even be more important is inflammation. The intestines it's really the outside world passing through your body as a tube. And we want to let things in, but we also want to police certain things out. And what can end up happening is, when there's too much leakage, too many particles going through what's sometimes known as a leaky gut, or this highly permeable gut, it's the immune system that's on the other side of that membrane, and its chief instrument is inflammation, which is good when it's a pathogenic protozoa or an amoeba that the immune system should fight with inflammation. But when that process is running excessively, now you can have high levels of inflammation. And this is why we see correlations with inflammatory conditions and things like leaky gut. So it could be brain fog, it could be joint pain, it could be skin eruptions, it could just be a general malaise or fatigue that occurs secondary to that inflammation. And the third big factor ties in with what you were saying about sort of stress, burnout, adrenals, is the connection between the gut, your brain, your limbic system, and how the limbic system, so the limbic system is the hypothalamus, the thalamus, the hippocampus, and the amygdala. And people have probably heard of the hypothalamus as the master regulator of the endocrine system. Well, it regulates your adrenals. And some research has found that when you improve gut health, you actually see a normalization of cortisol output. So there's a big tie-in from the gut to the brain, to the brain to the adrenals. So that's not everything, but I think those are maybe the top three that I that I would submit. If people can improve their gut health, they have better nutrient absorption, better immune system regulation and inflammation, and then they can probably improve endocrine output through the limbic system and the hypothalamus.
And so that's going to improve mental performance, which I think is fundamentally important to this whole process for these executives. And just take us from the difference between females and males, because I'd like to sort of set a frame of where you start. I mean, obviously, one of the biggest areas is people come in, what food they put in, ultra processed foods in their mouth. And we want to, change as much as we can that's going to move the needle the most, or should I rather say, what are the biggest things and a framework that someone's listening and saying, geez, I got brain fog. I've got a bit of a dodgy stomach now and then, and I can't just eat what I want to, and I bloat a bit, and I've got a bit of discomfort. But I'm really concerned about just levels of anxiety, levels of depression. I mean, these are exponentially increasing worldwide, especially here in South Africa. It's never I've seen in 25 years of practice, people struggle with their mental health and performance. We even do a cognoscopy which is an online test by
Mm,
Dr. Dale Bredesen, and having a look
Bredesen, yeah.
happening to the brain. So take us through your framework that someone's listening saying, okay, I haven't even looked at my gut with regards to mental performance.
Right. Well, I'll just quickly, by the way, really love everything that you said. And remember that the limbic system also is in charge of fear and anxiety and conversion of short-term to long-term memory. So there's a lot of cognitive implications associated to the limbic system, and that does tie back to the gut. So the first appraisal you could take, like you were saying, a dodgy stomach, maybe I notice I skew more toward loose bowels, and that's, a few or several times per week I have a bout of loose bowels, or maybe I'm more constipative, or maybe I have this reflux and this prolonged fullness. These are all little flags that something's awry in the gut, and that could be impacting the brain. So then what do we do about it? Well, I'm assuming that your audience is probably educated enough and proactive enough to where ultra processed foods are not an issue. They're probably exercising. They're probably paying attention to sleep, not drinking alcohol to excess, right? All those fundamentals. So I'm going to assume that layer has been addressed, and then go to the person doing those things as best one reasonably can do. Then the framework, I've been looking at sort of these various gut types, because it helps us select the best diet. Coming back to my earlier point that it's not all about keto or about plant-based. I think they all have a time and a place, but it's how do we pair the dietary intervention with the individual? And so there's clues that we can look for. The bacterial type gut. So let me take a step back. There's three types. There's bacterial, fungal, and immune. The bacterial type guts, they tend to be the ones that have too much bacteria, and they flare when they consume foods that feed bacteria. And these are foods that we often say are healthy, like broccoli, asparagus, cauliflower. These are the high FODMAP, high or high prebiotic foods. So prebiotics feed the bacteria, the probiotics. And what's interesting about this is someone might come into the clinic and say, the better I eat, the worse I feel. I load up on vegetables and fruits and I feel bloated. And then after I feel bloated, I feel kind of foggy and tired. Well, again, it's not good or bad in absolution. It's if your system, if your stomach, if your intestinal tract already has too much bacteria, and now you're eating a diet that's really probacterial, you're flaring the problem. So these people do really well on a low FODMAP diet. And by the way, there's numerous clinical trials demonstrating efficacy for symptoms, most typically as IBS, so gas, bloating, abdominal pain, constipation, diarrhea, but also a number of trials showing reductions in leaky gut. And this tends to generally correlate with cognition. It's not an absolute rule, but if we can assume that the degree of gastrointestinal symptoms generally correlates with cognitive function, again, not an absolute rule, but if we can improve the gut symptoms, we generally tend to see an improvement in the brain symptoms. So I'll pause there, but that's the first gut type.
Yeah, and I think this is important because I just listen to you a lot, and you've always said, okay, if you're going to do this and say you're going to change your diet and you're going to take a lot of prebiotic fiber and you're going to have a lot of these, vegetables and fruit and these, feed the bacteria, and you don't feel good, you give it 3-4 days, 5 days, and then you see the response in terms of what happens. If it continues those symptoms, then possibly it's not, something, and changing one variable at a time, it's not for you, and you might need to change that approach. But what happens from a data-centric model? We run a very data-centric model with heart rate variability. Do you have any science or sort of any experience of someone starts like a food because they got issues, and all of a sudden, they're not sure, and was it now the alcohol? Was it actually they started eating more asparagus, and now they possibly eating some lectins, or they eating some oxalates, and it gets complicated. But from a data-centric point of view, is there any way to quickly assess after 5 days to say, hang on, I've got to persist with this, or I've actually got to stop based on the first bacterial gut?
Yeah, this is a great question. It's really a clinical question in terms of how do we assess if we're on the right track? Usually you're going to see clear response by week 1 or 2. Now, the challenge can be that people tend to have variability in their baseline, meaning very few people feel the same day over day over day, but there's, a little bit of ups and downs. And so what you're looking for is assessing the slope of that line. Is the slope going upward? Are the better days a little bit better? Are the down days not quite so bad? And so that's what tells you if you're on the right track. So 3 days might be a little bit early, right? But by the time you're at the end of week 2, you should be able to do a look back and say, you know what? Generally speaking, I'm better now than I was 2 weeks ago. And if that's the case, you want to continue. Sometimes you'll have a very clear answer, meaning, let's say you are a bacterial type and you go on like a low carb, high vegetable paleo diet. You may notice within 2 days, like, holy smokes, I'm bloated. My bowels were very loose, right? So, okay, the negative reactions tend to manifest a little bit more quickly than do the improvements. So, I guess do with that what one will, but give yourself, I would say, at least 2 weeks. That should tell you, am I on the right track? Or if you have a pretty notable negative reaction, that tells you we're on the wrong track, and then go to a different one.
Okay. So nothing on heart rate variability or looking at, temperature or any sort of data that you would link to in terms of improvement.
The way I look at HRV, temperature, is those are going to be lagging indicators. I think the most leading indicator is going to be your symptoms.
Brilliant. And what about stools? I mean, now would be a good time. Should they be daily in the morning? I've been a doctor of Chinese medicine for so many years. We always say you want to pass a pretty solid, bulky stool, not hard, not constipated at all, but on a daily basis. And I know this can be sort of very variable in terms of people's just nature and nurture. But what is your view in terms of what people should be looking at from a stool perspective if things are improving?
Yeah, great question. The Bristol stool chart is kind of a nice visual for people. You want to be right in the middle. You don't want to be a 7 or a 1. You want to be like a 3 or a 4, which is kind of like a sausage or torpedo. And I think having a bowel movement every day is a good goal. Some people will be 2 or 3. Some people might be every other day. But, this gets a little bit hard to say absolutely, and not going too far afield. But some people, depending on the anatomy of more specifically their colon, they might be more tend to go once per day or once every other day. And this has to do with how tortuous the colon is. The colon should be kind of like one straight road, a turn, another straight road, and then the rectum. So it's the ascending colon, transverse colon, descending colon, rectum. But some people have a really twisty, turny sort of road of the colon where things can get stuck. Almost think about it this way. If two people were driving, one person took the highway, straight road, the other person took the back roads, twisty, turny, and windy, it's going to take the person on the back roads longer to get to the destination. That same thing can happen in the colon. The therapeutic that can help these people, because this is more anatomical, is abdominal massage. And I was a little bit skeptical about this until I saw a meta-analysis of numerous clinical trials showing that I believe people had 3 more bowel movements per week. So that could be someone who's going every other day to every day just by rubbing their stomach for about 5 minutes per day. And then you just sort of trace from lower right, you go up, over, down, and out, tracing the line of the colon. And that can help just push stool past those sort of inflection points where it can get stuck. So it's going a little bit far afield, but just it does speak to sort of the bit about regularity of the stools.
Sure. And yet we've also found using infrared and red light using a portable device on the gut has been really helpful for people to pass the stool. So just out of interest. Now, this bacterial type, so they should go on a FODMAP diet. Maybe you want just to explain a little bit that. And then I've got, and I'm not looking at brands here, so I don't want to look at brands. I've got a whole bunch of probiotics here. And I want to talk through those 3 subsets because they're a good frame, So what probiotics should they be taking? Should they be taking digestive enzymes? Things like slippery elm, things like aloe, things like licorice, things like mastic gum. Because someone's listening and saying, "Oh, flip, I'm a bacterial, gut, and so I need to do something specific."
Sure. Well, let me, I guess, because I definitely want to go to probiotics. It's a very important therapeutic, but the other type is fungal. This is when there's an excess of fungus. And these people tend to do well on the higher FODMAP, higher prebiotic, higher fiber diets. And they tend to flare when they have things like white rice, white potato, starchy vegetables, and high sugar fruits like bananas and mangoes. People who are the fungal type, there's a few background factors we can look at. If they've had oral thrush, a white tongue. For women, if they've had recurring vaginal yeast infections, one time, 75% of women will have one bout of vaginal candida in their reproductive year. So I wouldn't say one bout is sort of prognostic, but recurring bouts. If you notice rashing in the folds of the armpit or the groin or jock itch or toenail fungus or cravings for carbs, if you're someone who says, oh, well, I just like something sweet after dinner. I don't feel satisfied unless I have that sweet, that carby, that starch, that chocolate, that sugar. When you've eaten enough calories, then that's an indication that, all these things are indications that you could be the fungal type. So, that really does steer the diet, because coming back to the bacterial type, you put them on a high starch diet and oftentimes they do great. In fact, the SIBO breath test preparation diet is essentially white rice and meat. And the bacterial types will often say, Doc, man, during that prep diet, I felt awesome. A fungal type on that diet will say, my bowels were loose, I was foggy, because they fed the fungal overgrowth. So I just wanted to make sure to hit those two. And the third is immune with, and this does get a little bit more nuanced, but these are people who may notice they're environmentally sensitive. They have a lot of allergies, a lot of reactivity. They may notice they have flushing, rashing, like hives, a runny nose, sometimes insomnia. And these people may also notice that fermented foods, as great as those can be, they tend to flare from a high intake of fermented foods because those are actually high in histamine. So the immune types have an overactive immune system. Histamine is a mediator of the immune response. So think, I have allergies, I take an antihistamine, I take Benadryl, Claritin, one of these anti-allergies, those block histamine. You can also eat histamine. So if you're someone who's kind of allergic-y, so to speak, and then you eat lots of histamine, you may notice, boy, I had a kombucha or a bunch of sauerkraut or what have you, and that seems to not sit well with me. This is where a low histamine diet can be helpful. So the three different diets to play with would be a low FODMAP diet, a Candida diet, and a low histamine diet. And the cool thing is, coming back to our earlier conversation about this, 2 weeks, right? It doesn't have to be a super long intervention. So you can run through these at a decent clip and get yourself on the right dietary track before thinking about something like probiotics, which would definitely be one of the next things to go to.
Okay, so maybe just explain the FODMAP and then the Candida. So someone's listening saying, okay, I'm more bacterial, I'm more fungal, and then
Sure,
immune.
sure. So the low FODMAP diet reduces, so FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. It's forms of carbohydrates that are prebiotic rich, that feed the bacteria. And these are a lot of sort of healthy vegetables and fruits: cauliflower, asparagus, broccoli, onions, garlic. These are all high FODMAP, whereas spinach, kale, bok choy, summer squash, zucchini, these are lower FODMAP. It's pretty easy to look up a food list. You're going to see disagreement amongst some of them. People can always search my name in a low FODMAP diet if they wanted to hear it. From my perspective, the University of Monash is really pioneering most of the research here. They have an app also, so if you want to have an app, but pretty easy to find a low FODMAP diet guide. The Candida diet is essentially a lower starch and sugar diet, but an important caveat is it doesn't have to be very low carb. And some people will notice if they go very low carb, that might be good for fungus, yes, but they don't sleep well. They have fatigue. And women, if they're too low carb for too long, may start losing their cycle and having falling hair. So we were really careful when we put together our Candida diet not to just say, oh, all carbs off the table. It's got to be this really low carb diet. That will work for Candida, but it'll not serve a subset of people for whom metabolically they can't thrive on a definitionally low carb diet. And then the third, low histamine diet. Again, we have a guide for all of these, but it's essentially reducing fermented foods plus a few foods that inherently have high histamine, like canned foods, cured meats, spinach and avocado are also a few other examples of high histamine foods.
Brilliant. And I did go into your website and I put my email in, and then you get the FODMAP diet straight to you. So we'll put the link in the show notes for that. And then is that the same with the Candida diet, or do you have to request it? And for the low histamine diet?
Yeah, it's hard to keep track of how all these things are accessible, but either they're directly accessible, or for some of those, we just, we do an exchange for someone's email. I probably should be better about how those things are organized on our website, but they're all out there.
Yeah, they're out there, and it's in a brilliant low FODMAP. So I've checked it out already, and I think it's really
Thanks.
important to understand. So well done there. Let's talk about digestive enzymes. Having looked at probiotics and had a dispensary now for 17, 18 years, I want to get into the nuts and bolts of probiotics, how important, but let's get your view on digestive enzymes, because I find that just the food that we have has been stripped of these enzymes. People are really battling to break them down. What is your view with those three categories on taking digestive enzymes?
I used to use more enzymes than I do at current. And there's a couple of things that led me to this conclusion. I got really excited about what's known as exocrine pancreatic insufficiency, or EPI. It's sort of diagnosable low enzymes, low pancreatic enzymes. Alana Gurevich, who's a colleague and a friend, had some really interesting information about this. She's a naturopathic gastroenterologist. And so for a while, we were running the test. It's a stool elastase test. And if it comes, I believe the cutoff is below 200, it indicates that you would benefit from pancreatic enzymes. And there's definitely randomized control trials showing benefit when people have this insufficiency via the stool test, and then they use an enzyme. I think the reason why we didn't see a lot of benefit is because there's also some data showing that you can improve enzyme function, including pancreatic enzymes, but not limited to them, when you improve someone's gut health. So I think there's a time and a place, but my suspicion is that if we intervene upstream with the right diet type, with addressing some of these overgrowths and imbalances, there's a reduced need for the enzymes. So I'm not saying that there's never a time and a place, but we're using less of them as, we've been focusing more on some of these upstream factors. But if someone has loose bowels and bloating, those are two of the hallmark signs that they may be maldigesting, and therefore they could benefit from an enzyme. Enzymes are oftentimes lumped in with acid, or HCl, hydrochloric acid. Some products have them together, some have them separately. With HCl, it's also something that you do see some people need, but I feel it's more rare after a few years of really sort of putting it under the microscope, so to speak, and determining, let's try to do this in isolation and see if people really need them. I think it's less commonly needed than we may have previously thought. There's a few risk factors. If you're over 65 years of age, that increases the likelihood. If you have or have had an autoimmune disease, that increases the likelihood. And if there's a prior history of anemia, that also increases the likelihood up to about 50%, up to, meaning not guaranteeing 50%. But and then with the autoimmunity piece, for those with hypothyroidism, that is something to think about, because 20 to 30%, the studies on this vary in terms of their findings, but 20 to 30% of people with hypothyroidism have been shown to have low stomach acid. So especially someone who's hypothyroid and there's been repeat either B12 anemia or an iron anemia, that's where we're thinking malabsorption on the one hand, yes, but that malabsorption may not be due to dysbiosis, overgrowth, leaky gut. It might be due to low acid. If you do the acid supplementation or the enzyme supplementation in isolation, you'll know within a week if it's helping, right? So for acid, it's mostly upper GI, prolonged fullness, reflux. That should improve pretty quickly. And if it's enzymes, it's more so bloating and looser bowels. That should also improve pretty quickly.
Brilliant. Before we go into the probiotics and supplementation, maybe you want to just speak to, so I know I'm going to get these questions. We had a Instagram reel that went pretty viral on oxalates. And maybe speak to, in terms of those three frames, because it's important, oxalates and lectins. We had Dr. Gundry on the show talk about lectins and the lectin-free diet. And, so I think that's really important, and amyloids. And let's give a bit of a frame when it comes to those three sort of subgroups.
Sure, sure. With oxalates, this is something that we had Sally Norton, who speaks a lot about oxalates, on the podcast maybe 3 years ago. We were using that diet and we saw some response. I was also running a urinary oxalate, trying to use that as a predictive marker. I got away from it for a little while. And then more recently, due to another colleague, Tanya Dempsey, who's an MCAS specialist, reporting to me that she's seen some benefit with it, we've been experimenting with it again. So I'm still trying to make my mind up on the oxalate piece. Let me take a step back and explain sort of the paradigm. The more reactive someone is, the more they look for correlations between their diet and their symptoms. And what can end up happening is, if you're missing the actual cause of their symptoms, people start forming false connections. So something that should occur is, if there is a food intolerance, it should be fairly routine, meaning it shouldn't be like a 50-50. Sometimes histamines bother me, sometimes they don't. Sometimes oxalates bother me, sometimes they don't. And so I think what ends up happening is, people are having these ups and downs naturally, and then they start low oxalate, low lectin on an upswing, and they can falsely conclude that those foods are the problem. And why this matters is, we just want to be a little bit careful not to overly avoid food. And for someone with symptoms, there is sort of like a pull, a gravitational pull toward overly avoiding food. So I always try to kind of balance these things, just to make sure people don't go too far in the direction of food avoidance. But coming back to oxalates, there's at least some speculation that those who have a fungal type are more prone to having oxalate sensitivity. And it might be because, I believe, fungus can produce oxalates. So we're sometimes, so we'll start with one of those three dietary types. And then if we see partial response, but not full response, we might then layer in a low oxalate intervention for a term and see if we obtain some additional benefit. But also just have people do a dietary audit, if you will. Hey, here's a list of high oxalate foods. Are you eating a whole bunch of these? If so, just try to pull it back a little bit, being careful not to make someone anal about oxalates, because then it can be something where someone's really stressed. They have a follow-up and they go, oh, you can tell they're just really, really stressed out about trying to get rid of all oxalates. So the way I look at this anyway is, look at the high oxalate foods. You can have some, but just try to spread them out and swap in lower oxalates where you can. And again, you should know within the first week or two if it's the right change. Some people will notice this phenomenon known as oxalate dumping, where they have some joint pain that flares within the first few days. So if you do go low oxalate and then you see joint pain, it could really reinforce that it's actually the right diet for you. So there is one caveat there, where you'd probably want to ride it out to about the week mark before you make a conclusion. And then with lectins, I'm still making my mind up on lectins, but my suspicion is avoiding them is not as helpful as Gundry and others might be proclaiming, because on the low lectin diet, there's also a lot of other things that you end up cutting out. Like, some people are nightshade sensitive, some people are grain and gluten sensitive. So I would love to see a diet where they control for food quality, and one group does food quality improvements plus low lectin, and the other one just does maybe like an elimination diet. I would suspect that the impact of the low lectin is not as high as it's being represented. One of the things that also, if I can be totally candid, that makes me a little bit suspicious, and this is me putting on kind of like my professor academic hat, there's little to no research published on the low lectin diet. And, I understand when a hypothesis is really early phase, okay, you're just looking for correlation. But if you're years and years and years and years into sort of championing how important this hypothesis is, and there's only, I believe with lectin, there's one small observational study that was really not well controlled at all, that's when I start to really take pause, because we should be examining our hypotheses and putting them to scrutiny to make sure that they're accurate, because you're going to have people with confirmation bias. I wasn't feeling well. I saw a lectin video. I cleaned up my diet. I feel better. Well, is that the lectins, or was that just all the other things that you changed in your diet? So I remain open-minded, but I'm a little bit skeptical about the lectins.
Sure, brilliant. And we'll put a link to Sally Norton's podcast and Tanya Dempsey's podcast here on the show, which I thought were very, very informative. I keep on delaying going to the probiotics, but let's talk quick about testing. I think you spoke about the organic acid test and looking at oxalic acid. Do you do a GI map test, or what is your basic testing for people when they come into your clinic? And I know that you see national, I think you see international sort of patients and clients. So we will put links to Dr. Ruscio's website, because I think he's one of the leading experts in gut health, absolutely, from a scientific perspective and from a practitioner perspective. But what testing are you doing?
For the bacterial type, there's two things I look to. If there's an IBS diagnosis, that's demonstrative, or you can do a SIBO breath test. That test is not perfect because especially the lactulose testing. So when you do a SIBO breath test, you drink a solution and then you test your breath every 20 minutes for about 3 hours. But the solution can be predominantly either glucose or lactulose. And the lactulose test does have a decent amount of what's known as false positives, meaning otherwise healthy people will test positive. So the SIBO testing is really important to state. It should not be looked at as the primary dictator of care. It should be a secondary, right? Your symptoms, your history, what supplements flared you, what supplements improved you, what diet flared you, what diet helped you. Those are the primary things for us to look at. Secondary to that would be a SIBO breath test. And it's really important because you see some people sometimes at the exclusion of everything else, even signs that their body is screaming to you, those are ignored. And there's this sort of like tunnel vision focus on treating the tests. So with SIBO breath testing, yes, it's validated, but I would look at it as complementary, not the primary informative biomarker. And for fungus, it's a little bit harder. We covered on the podcast in the past one paper I found to be fascinating. The researchers had someone either brush their teeth after every meal or once per day. Now, when they were brushing once per day, the level of fungus in the stool was 10 to 100 times higher. So there are things that people might be doing unbeknownst to them that are influencing how much candida shows up on the stool. And so then it murkies the read of, well, how diagnostic is that stool result? There is the organic acid of diarabinitol, and there's a blood test for antibodies. And so what we've been doing is we're pairing essentially 4 things. The Candida questionnaire, which just looks for some of those things I outlined: jock itch, recurring rashing, recurring vaginal yeast infections, thrush, carb cravings. We pair that with a stool test plus the blood antibodies plus the diarabinitol. And we're trying to make up our mind in terms of how do all these sort of correlate, because it's not as straightforward as one would think. And so coming to your comment about the GI map, I've looked at probably 2,000 stool tests over the past 5+ years, especially in the heyday of me running 2 stool tests on every person out of the gate. And I would do like a GI map plus a doctor's data and look at the results. And you see more often that the results do not agree than they do agree. And this is a big problem. And this has been corroborated by Alison Seebecker, amongst a few others. So stool testing also, I would say, takes a back seat to what we call clinical suspicion. Your symptoms, your dietary history, your treatment history, because there's just some noise here in that signal.
Okay. And what about microbiome testing? There's these all having a look at the different microorganisms you've got. Are you doing any of that testing? Because it came out the gates and it was this new frontier and this is going to change medicine. And I'm not so sure about the validity of that.
I agree. I agree. And boy, this is going back probably 5 years again. And we had Professor Robert Knight on the podcast. He's one of the leading academic researchers in microbiome testing and just research in general. And he said this tongue in cheek, but he said, you know, if a patient presents to you with microbiome test in hand, demanding treatment, he said, refer them to someone in psychology. Now, again, that's him being, you know, just making a joke, but the underlying point I think is correct, which is the microbiome tests, they're not clinical, they're academic. And we really shouldn't be making treatment decisions based upon those. And I'll share one quick anecdote. You probably have heard of this already, but just for your audience, Ubiome, that was one of the out of the gate really popular tests. They were shut down by the FBI for insurance billing fraud. But as part of that investigation, they discovered that dog feces was part of the data used to establish the normative test values for humans. So there's really some sort of, in some cases, sketchy business and sort of like speculative reaching that these microbiome testing companies are doing, especially when they say in these marketing claims, direct to consumer, you know, do you want to uncover why you're overweight or why you're tired? You know, your microbiome holds the key. And for me, that's always been challenging because in a way, I agree that if we can improve someone's gut health clinically, that can have a pretty massive impact on someone's health. But is the road to that mapped by the microbiome testing? I would say pretty confidently, no, it's not.
Sure. Okay, let's go into, these are some of the products that have got spore biotics and, you know, lactobacillus and bifidobacterium and different ones here. And then some of them are broad spectrum. They've got lactobacilli, acidophilus, and then some Druberkelli, and then Paracasi and Plantarum, and Streptococcus thermophilus, some of these words, and Plantarum, and something like Saccharomyces boulardii in this one as well. That's a combination. And I'm obviously not going to mention names. I don't want people to look at the exact names. Paracasi and Plantarum. I mean, there's just so many of them. And obviously, looking at getting a broad spectrum, you know, I'm of the belief, and you're the expert, but not for people just to stay on probiotics the whole time, but initially start taking them, seeing how they respond to the different ones, maybe taking a broad spectrum, not just taking the one. I've got some people that come to me, they've been taking 5 years, they've been taking the same probiotic every single day. It's just, I'm not sure about the length of doing that and the sort of the value of doing that. So maybe give us your overall sort of view on probiotics, how you use them, and then sort of just the longevity of every single day using the same one and not giving any time to see what happens with your gut when you're not taking probiotics.
Yeah. Well, the sort of principle I follow clinically is we want to use treatments until we get someone to a point where they have little to no symptoms, and then they've been stable there for at least a month, ideally 2 or 3. And then we do 2 things. We broaden the diet. I like doing that first because that seems to have the biggest impact psychosocially. I can go out to dinner. I'm not worried about the menu. I'm not grilling the waiter about, you know, how the oils are used or whatever. I'm more resilient and more robust. So the first thing I like to do, broaden the diet. Once we get stability there with sort of hopefully this newfound food freedom, then we start peeling back the supplements and we look for the minimal effective dose or the, you know, the minimal effective program, which is a really important principle because there is this drift toward more, right? So, you know, we do want to be on the back end trying to weed and reduce. There are some data points showing that if you discontinue a probiotic too early, you can see a regression. This is a wonderful study by Quigley and colleagues. They gave people a probiotic, they monitored their IBS symptoms, and they also monitored over time their cortisol awakening response, which is probably the most accurate way to measure cortisol output. And it's a beautiful visual. And this, we've discussed this on a few of our YouTube videos, but what you see over time is at baseline, they have a blunted or a low amount of cortisol release. Then they start the probiotics. A month in, their cortisol output is improved. 2 months in, it's even better. Then they stop. There's a washout period. Month 3, cortisol levels are going down. Month 4, cortisol levels are back to near baseline subpar. So that's only a 2-month intervention, but it does make the point that if you discontinue a therapy too early, you can have a regression. Where that line is probably going to be different for different people, right? So I think coming back to symptoms, we want to have that bigger picture objective of broad diet, minimal supplements, But as part of that experiment to determine what your minimal effective plan would be, come off your probiotics and then see how you do. Do you notice 2 or so months later, bowels start to get more loose, you're more constipated? I think that's the best way to approach this. Getting these in from your diet, also really important. And we did a video review, a podcast review on this a few months back, which was eye-opening for me in terms of you can get adequate probiotic from foods, from fermented foods. And we created a table where we just go side by side with various foods next to a supplement, and they're on par. So you can obtain a similar dose via food as you can from a supplement. So I would favor the foods, other than those who might notice are histamine sensitive and they just don't tolerate too much of an intake of these fermented foods. There's one study so I guess zooming out, what about healthy people? Because that partially also answered your question, right? Do healthy people benefit? Otherwise, healthy people benefit from probiotics. One study in nurses found they had better mood and improved empathy scores when using a probiotic. So they weren't depressed, they were normal mood, but they had even better mood and empathy from a probiotic intervention. And then another study in otherwise healthy individuals found that probiotic supplementation increased glutathione levels. So there might be a little bit of a case for longer term, but I think when it's done in the paradigm of you're attempting to find the minimal effective dose and you're not expecting the probiotic to be necessary in the long term. And there's the categories, but I guess I'll pause there for a second before we jump in on that.
No, and then I think just make a comment on, these different sort of, because people don't know about probiotics, I don't like to keep someone exactly on the same unless they're doing well and it really helped them and it's broad spectrum. But taking plantarum the whole time, we've got immune booster ones, and some of the research shows that it can improve sort of immunity. They've done well, and then including the Saccharomyces boulardii. And I know there are 3 types or 3 subsets. Maybe you want to explain that and where you start using probiotics. I think that's really important. People are sort of they're unaware of how the quality as well, and shelf stabilized, and should it be in the fridge. I think
Sure.
some perspective there.
Yeah. A lot of great stuff there to speak to. One thing that I find interesting, and this is in part hypothesis on my side, but most probiotics don't lead to long-term colonization. Some do colonize, but many do not. But rather, they seem to have this transient impact where they stimulate your immune system. Specifically, there's one receptor in particular that I find pretty important, TLR4, toll-like receptor 4. This regulates LPS, or leaky gut particle response, but probiotics can also attenuate the function of that receptor. So they do so in a transient fashion. They pass through almost like tourists, right? If there's a city that people really love to visit, tourists come in, they spend money, they feed the economy, and then they move on. So you need this flow of tourists to spend money in the local economy, or this flow of probiotics to stimulate receptors in the gut from an immune perspective. As it pertains to shelf-stable or enteric-coated, the most seminal meta-analysis was by Zorzella and colleagues. Fascinating study. They took probiotics, they heated them up to kill them, what's known as heat-killed probiotics. And they found that the heat-killed probiotics were essentially as effective as live, intact probiotics. And this might reinforce the immune component, where the dead probiotic still triggers that immune receptor. It's less prone to colonize you, but still has an immunomodulatory impact. So I do think the enteric coated or the refrigerator pack probably doesn't really matter like we used to think a number of years ago. Then in terms of, there's so many products out there, how do we provide some sort of heuristic? The way I look at this is there's 3 different types of probiotics. One is actually not even a bacteria, it's a fungus. This is your Saccharomyces, so Saccharomyces boulardii or Saccharomyces cerevisiae. These both have pretty good research showing benefit for a number of conditions. There's your traditional type. You hit some of these earlier, like Lactobacillus plantarum, Bifidobacterium infantis. And what you see in these formulas is a blend of different Lactobacillus and Bifidobacterium species. And then third and finally, you have your soil-based, which is usually one or a few different bacillus species. there's going to be variability, but as we've really created data tables where we look at different formulas comparatively, you see similar benefits for different formulas, making me conclude that generally speaking, the action or the benefit from probiotics is not very species or strain specific because they're not drugs, right? They're not acting to block a certain pathway. But rather it seems that they're having this immunomodulatory benefit. They're also antifungal, anti-SIBO, in part antiparasitic. So how those interventions are going to impact the host health probably varies, right? Some people who have bacterial overgrowth will be constipated. Other people will have diarrhea. This might be why we see the same probiotic improve constipation in some people and resolve diarrhea in other people. This doesn't happen with a prescription laxative. It's only going to push you one way, right? So this is why, even though we face this headwind, because science likes to be very specific, but there is a point at which specificity gets in the way of clinical decision making. And so the way we're approaching probiotics is not saying, well, you have depression, so it's this probiotic. You have constipation, it's that probiotic. Again, because the clinical trials are showing the same formula can impact different conditions. You know, a lactobacillus bifidobacterium blend probiotic can help constipation, it can help depression, it can help diarrhea. So therefore, we try to put together the strongest or broadest using these three different types together with the chief aim, not of treating the symptom, but of optimizing the person's gut health and then seeing what symptoms resolve, what symptoms still remain. And that's when you can go after a symptom in a particular fashion. Like let's say someone had brain fog, abdominal pain, and constipation. The probiotic resolved everything but the constipation only partially. Now we say, well, maybe there's a high level of tortuousness, those bends in the colon. So, okay, try abdominal massage for a week and then report back, right? So that's how we sort of, phase this, where the probiotic's probably going to wipe out a lot of symptoms. The ones that are left standing, you can then have a more specific intervention for on sort of a case-by-case basis. And the guidelines are you can use one formula. For a lot of people, one formula is probably going to be sufficient. If you want to go stronger, this is our hypothesis, hasn't been published. We're hoping to publish on this sometime in the future. You can combine all three of the formulas and use them synergistically. We call this triple therapy probiotic. Just like in certain models of medicine, they use 2 antibiotics together or 3 antibiotics together to kind of get this, or in some cases, 2 blood pressure lowering medications together. Not that I'm advocating doing this, but it just makes the point that using multiple interventions that do the same thing is kind of commonplace in healthcare. We're just applying that to the use of probiotics.
Very, very important, very fascinating. And those 3 groups make a lot more sense. You've brought a lot of clarity to myself, because I know the soil probiotics, the bacillus, that often in fulvic acid, and that cause me a lot of sort of flatulence and sort of, it doesn't settle as well as the other 2. So possibly my system's not responding like it should to that probiotic.
Well, this is why we separate out the prebiotics separately for that very reason. So there's kind of 2 things there. And I'm so glad you made that point. Not everyone responds well to the 3 different types of probiotics. So this is why just having that framework can be helpful, because some people will say, oh, I've tried like 5 probiotics and they never sit well. Well, they tried 5 different formulas of the same thing, right? Or there's prebiotics in there, and prebiotics can flare some people. So a small amount, if we're talking a few 100 milligrams of a prebiotic, that's fine. When you get to about 3 grams or 3,000 milligrams, that's the level at which it can start flaring symptoms in some people, which is why we generally leave the prebiotics rather out of the probiotic formulas, so we can isolate for the variable of probiotics first.
Brilliant. I've got 2 questions left. I know we're coming to the end of the show, but let's talk about, I found glutamine one of the best in terms of gut health and dysbiosis, and that using things like slippery elm or mastic gum or licorice. aloe sometimes. What is your view on the other supplements in terms of go-to? A lot of my sort of corporate execs, business leaders, they do have quite a bit of alcohol. When I say quite a bit, they often having 1 or 2 glasses per day or 1 glass per day. I find if they take some glutamine before that alcohol, it really settles things. They have less issues. We've even correlated looking at sort of wearable technology and HRV and alcohol, and then taking the glutamine before. But give us your view on some of those supplements that I mentioned.
Sure. Well, I would also just slip in really quick that there are some experimental models where they induce gastrointestinal irritation with NSAIDs, and they've found, this is in mice models, can't do this ethically in humans, but they found that probiotics can negate that NSAID or pain medication induced damage to the gut lining. So I would assume the same thing would apply for probiotics. Probiotics have also been shown to improve liver enzymes. So if someone is having liver enzymes secondary to alcohol, that's another benefit for the probiotics. But yes, Kiki Zhao published, she's at Tulane, a really fascinating study using high dose glutamine. I think it was 15 grams per day, which is a little high, but she found some pretty impressive results in leaky gut. I think 5 grams is, 5 to 10 is probably a more reasonable place to start. So yes on glutamine, and then yes on some of these soothing compounds like aloe, curcumin, even fish oil. Yeah, all these things are going to help to sort of buffer. Something else to consider would either be colostrum or an immunoglobulin. And the immunoglobulins are actually just a supplemental form of the mucous membrane in the gut that binds to toxins and other irritants and sort of neutralizes them. So some sort of cocktail, like you're saying, I think pre-alcohol makes a lot of sense.
Brilliant. Okay, last question. Just what you're excited about with regards to gut health. Been in practice so long, more and more people are just having a lot of problems with their gut. Obviously, you've got sort of, your vagal dysfunction, what's happening to distress out there, and just levels of, vagal tone and that. But tell us about what you're excited about in the future.
You're asking this question at a really good time, because you rarely as a clinician come across something that's kind of cathartic. And we recently have, and this has to do with what's known as vector-borne infections or microbes. These are bacteria or protozoa that can be spread by ticks, fleas, cats, dogs, biting flies, red ants. And the public service announcement I would make is, if you're doing everything right and you're having a lot of neurological symptoms, joint pain, or muscle pain, these are 3 of the biggest flags that there could be one of these vector-borne microbes present in your system. Again, when you're seeing a lot of neurological symptoms, and especially if there's joint or muscle pain that's migratory, it's here, it's there, maybe there's some muscle twitching. These organisms, Borrelia, Bartonella, and Babesia, can elude detection. In fact, just yesterday, we have a new doctor joining up the office, and he was shadowing. And I was telling him earlier in the week, Jake, we see one of these cases per week almost without fail. Like, it's kind of blowing my mind. And what do you know? The last visit of the first day of his shadowing, exactly what walks in the door. This poor gal who's been to a few other doctors, and she has brain fog, she has fatigue, she has air hunger, she has this transitory muscle pain. Sometimes she has muscle twitching. So if this sounds like you, gut health can definitely complement that due to the immune bolstering impact. But I think there was a subset of people for whom they hit this ceiling where I was always discontent with their level of improvements. And now we're realizing that there's another layer to this. There's one of these microbes that a lot of us are exposed to, but especially if you've had periods of stress or sleep, high alcohol consumption, all these things can weaken your immune system. I'm saying this because it's partially what happened to me years and years later. And you have these low-level lingering symptoms. You feel like you have to do so much to keep yourself kind of propped up. Like, you're getting by, but boy, it just feels like a part-time job with all the stuff you have to do. Then this is something I'm very excited about, and I think is more common than may previously have been appreciated, at least by me. So I'll throw that out there.
Brilliant. And hopefully at a later stage, we can have you on the show to talk about that. But just want to declare favor and blessing over you. Thank you for your courage. Thank you for your book. Thank you that you're taking really science to this. I think there's just, and people are well intended, like you said, and we're not anti-Western medication. We're not anti people using empirical evidence as well. I mean, there's a place for that, but we do need a science, and we need to make sure that the things that we're recommending are not hurting and they're helping, and they're not sort of, we're selling products. I mean, I think you get supplementation just to increase. I don't know, you've got a term for it. I heard it on your show, on your podcast, which we'll put a link to, where people are just taking so many supplements, and it's supplement creep. I think that's what you called it.
Yes.
Yeah, I
Yep.
just want to really thank you, and that you would just, we would blow wind in your sails. And is there anything we can do other than put the links in the show notes? How can we help Dr. Michael Ruscio?
Well, thank you. Right. I love having these conversations. I really appreciate when people, they care about a scientific approach, because, as a clinician and as a scientist, you see people who are really good at messaging. And unfortunately, it seems, especially like Instagram and YouTube algorithms, they really reward the hyper confident, right? It's all carnivore or whatever. And what I find disheartening about that is the people who are the most confident, there's this old saying from Darwin, which is ignorance more often begets confidence than does knowledge. So sometimes the people who are the most confident, without trying to cast any aspersions, are a bit ignorant to the contradictory data, but they message really well, right? They make a really compelling case. So I appreciate the opportunity as a clinician to try to share these nuanced conversations, because this is where I think people are really going to get the help. It's not die hard one approach or the other, but rather, how can we listen to your body, offer up some insights and clues that may help you along your path? So no, I thank you. Just having the opportunity to speak and to share is wonderful. So thank you.